Understanding common children's ENT conditions. Recognizing ear, nose, and throat (ENT) issues in children is crucial for ensuring their overall health and quality of life. Early detection and treatment can prevent complications and promote better health outcomes. This video delves into common ENT conditions in children, their symptoms, and the available treatments, providing parents with the knowledge to effectively address these issues. Consulting with an ENT specialist is often necessary for accurate diagnosis and treatment plans. Snoring and difficulty breathing. When asleep, sleep apnea in kids. What is sleep apnea? Sleep apnea is a serious disorder where breathing repeatedly stops and starts during sleep. It can affect all ages, including children. In children, it is often caused by enlarged tonsils and adenoids, obesity, or neuromuscular disorders. Addressing children's ENT conditions, like enlarged tonsils and adenoids, is crucial for treating sleep apnea in young patients. Symptoms of sleep apnea in children. Loud snoring. A primary indicator of sleep apnea is loud and frequent snoring. Pauses in breathing during sleep. Observing your child stop breathing momentarily during sleep is a strong sign. Restless sleep or frequent waking. Children with sleep apnea may toss and turn throughout the night. Daytime, sleepiness or behavioral issues. Lack of quality sleep can lead to excessive daytime sleepiness, irritability, and behavioral problems. Bedwetting. Sleep apnea can sometimes cause enuresis, bedwetting. Causes and treatment. The most common cause of sleep apnea in children is the enlargement of the tonsils and adenoids. However, obesity and certain genetic conditions can also contribute to the development of this condition. Treatment options. 1. Adenoid tonsillectomy. Surgical removal of the tonsils and adenoids is often the first line of treatment and can significantly improve symptoms. 2. Continuous positive airway pressure, CPAP. For children who cannot undergo surgery or do not respond to it, CPAP therapy involves using a machine that delivers air pressure through a mask to keep the airways open during sleep. 3. Lifestyle changes. Weight management through diet and exercise can help in cases where obesity is a contributing factor. Ensuring the child sleeps on their side can also help reduce symptoms. Persistent blocked runny nose and mouth breathing. Enlarged adenoids and nasal allergies. Enlarged adenoids. Adenoids are small lumps of tissue located at the back of the nasal passage. They are part of the immune system and help trap harmful bacteria and viruses. However, when they become enlarged, they can block the airways, leading to breathing difficulties. Symptoms of enlarged adenoids. Persistent nasal congestion. Constant stuffy nose is a common symptom. Mouth breathing. Children may breathe through their mouth instead of their nose, especially at night. Snoring. Similar to sleep apnea, enlarged adenoids can cause loud snoring. Recurring ear infections. Enlarged adenoids can block the eustachian tubes, leading to frequent ear infections. Difficulty swallowing. Severe enlargement can make swallowing difficult. Treatment for enlarged adenoids. Non-surgical options. Medications. Nasal steroids or antihistamines can reduce inflammation and congestion. Watchful waiting. In some cases, doctors may recommend monitoring the condition to see if it improves over time. Surgical options. Adenoidectomy. Surgical removal of the adenoids is recommended if they cause significant breathing difficulties, frequent ear infections, or other complications. Nasal allergies, allergic rhinitis. Allergic rhinitis, commonly known as nasal allergies, occurs when the immune system overreacts to airborne substances like pollen, dust mites, pet dander, or mold. Symptoms of nasal allergies in children. Runny or stuffy nose. A common symptom that can be persistent. Sneezing frequent and repetitive sneezing. Itchy or watery eyes allergens can cause eye irritation. Coughing postnasal drip can lead to a persistent cough. Dark circles under the eyes. Often referred to as allergic shiners, these dark circles are a sign of chronic nasal congestion. House dust mite treatment. Dust mites are a common allergen and a significant trigger for nasal allergies. Managing exposure to dust mites is crucial for reducing allergic reactions. Steps to reduce dust mite exposure. 1. Regular cleaning. Vacuum carpets and upholstered furniture frequently. Wash bedding in hot water weekly and use dust mite-proof covers on mattresses and pillows. 2. Humidity control. Keep indoor humidity levels below 50% using dehumidifiers or air conditioning. 3. Air purifiers. Use high-efficiency particulate air (HEPA) filters to reduce airborne allergens. 4. Medications. Antihistamines, nasal corticosteroids, and decongestants can relieve symptoms. Always consult a healthcare provider before starting any medication. Allergic rhinitis or nasal allergies in children. Understanding allergic rhinitis. Hay fever, also known as allergic rhinitis, occurs when the nasal passages become inflamed due to airborne allergens such as pollen, dust mites, pet dander, and mold spores. In children with allergic rhinitis, the immune system mistakenly identifies these harmless substances as threats, triggering the release of chemicals like histamine. This immune response leads to the characteristic symptoms of allergic rhinitis, including congestion, sneezing, and itchy eyes. Types of allergic rhinitis. There are two main types of allergic rhinitis. 1. Seasonal allergic rhinitis. Known as hay fever, it is triggered by pollen from trees, grasses, and weeds. Symptoms occur during high pollen seasons like spring and fall. 2. Perennial allergic rhinitis. Caused by year-round allergens like dust mites, pet dander, and mold. Symptoms persist throughout the year, but may vary in intensity based on allergen exposure. Symptoms of allergic rhinitis. The symptoms of allergic rhinitis can significantly impact a child's quality of life, causing discomfort and disrupting daily activities. Common symptoms. Nasal congestion, persistent stuffiness that can make breathing difficult. Sneezing, frequent sneezing, often in fits. Runny nose, clear nasal discharge that is constant. Itchy nose and eyes. Itching can lead to rubbing, which exacerbates symptoms. Coughing often caused by postnasal drip. Managing allergic rhinitis. Avoiding allergens. Identify triggers. Work with an allergist to identify specific allergens. Reduce exposure. Keep windows closed during high pollen seasons, use air purifiers, and maintain a clean living environment. Medications. Antihistamines help reduce sneezing, itching, and runny nose. Nasal corticosteroids, effective for reducing inflammation and congestion. Decongestants provide short-term relief from nasal congestion. Immunotherapy. Immunotherapy involves gradually exposing the child to increasing amounts of the allergen to build up tolerance. This can be administered through allergy shots or sublingual tablets and is often considered for severe cases of allergic rhinitis that do not respond to other treatments. Impact on daily life. Nasal allergies can disrupt a child's sleep, concentration, and activities. Poor sleep due to nasal congestion can cause daytime fatigue and irritability, affecting school performance and social interactions. Proper management of allergic rhinitis is crucial to minimize these impacts and improve the child's overall quality of life. Conclusion. In conclusion, understanding and addressing common pediatric ENT conditions is essential for safeguarding a child's health and development. Conditions such as sleep apnea, enlarged adenoids, and nasal allergies, if left untreated, can have a profound impact on a child's well-being. Parents should remain attentive to symptoms like snoring, mouth breathing, and persistent nasal congestion. Early consultation with an otolaryngologist ensures timely diagnosis and intervention, leading to improved health outcomes. Prompt treatment, whether surgical, medical, or lifestyle-based, allows children to breathe easier and live healthier, more comfortable lives.
The information provided here is intended for educational purposes only. It is not a substitute for professional advice and should not be construed as such. The content is based on general knowledge and may not be applicable to individual circumstances.
Thanks for watching. Like, comments, and share.